Of you asked talk about, and you asked talk about menopause. So first, let me introduce myself to those of you who are new to our channel, or if you've just come across this video, you should visit our channel for more informative videos about women's health. At any point in this video, please hit like and subscribe. So my name is Dr. Shevon Joseph. I'm a US board certified obstetrician gynecologist and the current medical director at Azalea Health Services. This is a monthly YouTube series called You Ask Doc About, designed to share answers and explanations to questions commonly asked by women in my practice. You and the women in your world will benefit from watching this series. This month, we will post a mini series of videos about perimenopause and menopause because the topic is quite exhaustive. So we've compressed it down to 4 videos that address certain aspects of menopause. And hopefully you enjoy the series. Watch to the end to find out if HRT or hormone replacement therapy is a safe option for you. So that's a good tidbit towards the end of the series. This is for informational purposes only. For medical advice or diagnosis, please consult a professional. So we keep track of the top questions that women ask, and in this series, we're going to talk about what questions were asked about menopause. In this 4-part mini-series, we will review what is menopause and how it could specifically affect you. The understanding and perception of menopause supposedly evolved significantly throughout history. I tend to have a different view of this, but let's review the timeline of this evolution. It's actually pretty short. In ancient times, in ancient Greek civilization, they recognized menopause as the end of menstruation, using terms like men for month and poien. I'm probably pronouncing that wrong, but that is Greek for to cease or to end. Back then, in the ancient Greek civilization, life expectancy was shorter. So there really wasn't any extensive literature or study on menopausal women, especially as women were often valued for their fertility. So once fertility ended, basically it was a wrap. So there wasn't much data on that in those times. Early medical practices focused on treating symptoms, sometimes with questionable therapies, because we all know medical research has traditionally excluded women, and we're severely lacking studies on medical conditions specific to women. The 20th century saw the development of hormonal therapies, and the role of medical professionals in managing menopause became more prominent. But just based on this short timeline I show you here, you can see that there have not been any huge leaps in knowledge about menopause and its management. Part 1 of our mini-series will address the following questions. What are symptoms of menopause? Why do menopausal symptoms occur? When can I expect to experience menopause? Will having a hysterectomy cause menopause?
So, Doc, what are the symptoms of menopause?
Menopause is when your period stops for good. It's diagnosed after 12 consecutive months with no menstrual period, no vaginal bleeding, no spotting even. Vaginal bleeding after menopause could be a sign of a more serious health issue, so it's important to gauge when that 12-month window would have ended. Menopause can happen in our 40s or 50s, but this varies. During this transition, the amount of hormones your ovaries make will fluctuate. Perimenopause, during this time of fluctuation, can last anywhere from 2 to 8 years. The average is about 4 years. Clearly, more studies are needed to investigate the differences in menopause with regards to age and to better understand the underlying mechanisms involved. The hormone changes can cause symptoms such as irregular periods, vaginal dryness, hot flashes, night sweats, sleep problems, mood changes, trouble finding words and remembering, which is often referred to as brain fog.
Y'all listen to all these symptoms for perimenopause. You got irregular periods, hot flashes and night sweats, vaginal dryness, weight gain, joint pain, muscle aches, skin changes, mood swings, difficulty concentrating, or memory problems, reduced libido. Make it make sense. And when I wake up in the middle of the night and my ears be itching, that shit's so stupid. Why is my ears itching? Tell me that's a symptom. Itchy ears and creepy crawling stuff on your skin. What that got to do with the reproductive system? How do you want us to do all this?
Different people will have different symptoms of menopause. Most women will experience irregular periods, however, as a common thread in between. Skipped periods during perimenopause are common and actually expected. Often, menstrual periods skip a month and return, or they skip a few months, then they return, and you can then be regular for several months in a row, for a few months well. So it can be a bit annoying, honestly, but the period cycles can start to get shorter as a sign of early perimenopause. So at first you might find your periods, they start coming closer together. And then as menopause gets closer, periods can start getting more delayed or further apart. Now, you can still get pregnant during this time. So if you skipped a period and you are sexually active and you're not sure if it's due to menopause, think about taking a pregnancy test. Atypical menopausal symptoms. This list is long, and I believe there's over 34 versions of symptoms related to menopause. So I'm not going to be able to list those out, but I will address some that are more on the atypical side because they can be really hard to diagnose. So atypical menopausal symptoms can include burning mouth syndrome, and I can still count on one hand the number of women I've actually encountered with this. The burning mouth syndrome, it's described as a burning, tingling, or hot sensation in your mouth, often on your tongue, and it can be quite uncomfortable, and there's no visible cause for it. The next atypical one I would mention is called tinnitus, which is really just a ringing, buzzing, or even hissing sound in the ears. Then there's an altered spatial awareness, which is just a fancy way to describe being more clumsy, difficulty with navigation, understanding spatial relationships can happen with menopause. Number 4 on the atypical list is electric shock sensations, which can be a sudden sharp pain that feels like an electric shock. And with that, you can also have altered skin sensations, numbness, tingling, or crawling sensation in the skin, which on a personal note, I get that one and I've been getting it for a couple of years, and it's really annoying. And it took me a while to accept that it was part of my perimenopause because I am in my 40s. There's another risk during this time frame, which I believe, even asked my dentist about this as well, because gum disease, inflamed gum, infection in the gums is actually more common during menopause due to hormonal changes. Who knew, right? So urinary dysfunction is another one, and this kind of overlaps with age-related changes, also changes that women will physically go through due to menopause, such as urinary incontinence, which means that you may leak urine or be unable to hold your urine. And you will have accidents. You can also have increased urgency during perimenopause or frequent urination due to weaker pelvic floor muscles, because the muscles that keep our bladder lifted, they do depend on a certain level of estrogen hormone. Women can have other atypical sensations during menopause of changes in their taste and smell. And it usually is described as a metallic taste in the mouth and an altered ability to smell foods, which is very strange. However, even recently, someone complained of that in the office, and we actually, before blaming menopause, I decided to treat her for sinusitis and rhinitis, and so far she's actually able to smell her coffee again. Other atypical symptoms could be cold flashes, which is very different to the hot flashes, which is more typical. Itchy skin, which I can attest comes along with that crawling sensation. There's like no rash, you just feel this itchiness, and it's called formication, which I wasn't going to mention that word because of how close it is to fornication, but there is a term called formication to describe just a general itchiness to the skin. Dizziness can also be another symptom that may not be well recognized as due to menopause. And because these are so vague, they can be missed as part of your menopausal changes, and that can add to the frustration that a lot of women feel with us doctors. Heart palpitations, or more so, which can be described as an awareness of your heartbeat, is another symptom during menopause and perimenopause that is linked to fluctuating hormonal levels, especially estrogen levels. While these palpitations can feel alarming, they are usually harmless. However, I'm not going to sit here and say that it's harmless. I'm going to always recommend that you are evaluated by your medical doctor or cardiologist before we can assign these symptoms to menopause, since you can also actually have critical heart disease that manifests with age. Right? But this menopausal related palpitations, they may involve a feeling of a racing, pounding, or fluttering heart, and triggered by hot flashes and anxiety, or even your night sweats. So if it's more situational, I'm having a hot flash and then I sense the palpitation, then yes, it's probably menopause. Or if it's happening at the time of night sweats, which is occurring during the nighttime phase during sleep as well too, that's another key indicator there.
Why do menopause symptoms occur?
Why do menopause symptoms occur? So most women experience menopause as a natural part of aging. Menopause can also occur after surgical or medical procedure. Menopause is caused by the loss of ovarian follicular function and a decline in circulating blood estrogen levels. So that's why we get symptoms. There's a natural decline in hormone production, primarily estrogen and progesterone, and also testosterone starts to drop, and a woman's ovaries stops releasing eggs. Periods become irregular and they eventually stop. So these hormonal shifts or declines lead to multiple physical and emotional symptoms. Estrogen plays a crucial role in regulating several bodily functions in women. For example, our moods is based on estrogen, or sleep, bone density, just to name a few. So when estrogen levels drop, these functions will be affected, right? So leading to symptoms like your hot flashes, night sweats, sleep disturbances, and changes in your moods. So again, while estrogen is the most significant hormone affected, progesterone and other hormones that play a role in vital function will also produce menopausal changes. So, for example, it is found that a drop in progesterone can contribute to your mood changes and sleep problems. And that ties in later when I speak about different herbal remedies where maybe you may not need estrogen as much. Maybe you will impact your moods in a positive way by focusing on progesterone, right?
When can I expect to experience menopause?
To answer this question, I think we're going to have to review some important definitions, right? So to transition into menopause usually starts with changes in the menstrual cycle, patterns, like I just mentioned. And this is then accompanied by other symptoms like the hot flashes. Most women begin menopausal transition between the ages of 45 and 55. And this process may last for several years. So perimenopause or menopause transition can begin 8 to 10 years before menopause actually happens. And your ovaries gradually produce less and less estrogen hormone. So this can start when you're in your 40s. You can be perimenopausal for several months or for several years. Many people begin feeling symptoms like irregular periods, hot flashes, and mood swings in perimenopause, while still not really experiencing the full impact until the period ends for 12 months. So menopause is a point where you no longer have menstrual periods, but you don't stay in this stage, right? So post-menopause is the time after menopause has happened, and this lasts for the rest of a woman's life. So most symptoms of menopause will ease up in postmenopause, but women do continue to have mild menopausal symptoms for several years well into postmenopause. So I'm not often shocked if I encounter someone in their mid-70s, in their 80s, who might still have the occasional hot flash, the occasional sweat as well too, depending on the person. And of course, the sleep disturbances can persist through the remainder of postmenopause. Menopause that occurs before the age of 45 is referred to as early menopause. And menopause that happens at 40 years or younger is considered premature menopause. When there's no medical or surgical cause for premature menopause and you're 40 or younger, it's actually referred to or diagnosed as primary ovarian insufficiency, or POI. And this is where a person's egg function has abruptly declined well before the average age of menopause. There is a lot of individual variability with everything that I just said, by the way. The timing and severity of menopausal symptoms can vary significantly from woman to woman, which is what really is the main problem as to why it's so hard to diagnose and pin down, and why some women are frustrated with their medical professionals. Factors like genetics, lifestyle, your ethnicity can influence how menopause looks for you. For example, tobacco smokers, women with high body mass index, women who lack physical activity can experience an earlier menopause than others. Some research indicates that the average age of natural menopause for women of Afro-Caribbean descent is typically at 49.6 years. This is slightly earlier than the general average of 51 to 52 years of women worldwide. But studies also show that Afro-Caribbean women tend to experience a longer period of perimenopause or transition into menopause. So who knows? Polycystic ovarian syndrome, or PCOS, and menopause needs to be mentioned as well too. Studies show women with PCOS may enter menopause an average of 2 to 4 years later than women without the condition. Women with PCOS may experience it closer to 53 or 54 years of age, but more research is clearly needed to understand family genetics and ethnicity.
Will having a hysterectomy cause menopause?
Natural menopause does occur after hysterectomy. So I'm going to say yes on that one. If the ovaries are kept during the hysterectomy, however, that woman will still eventually go through natural menopause, potentially at a slightly earlier age than when she would have had it without surgery. Surgical menopause is a term used when menopause is induced by surgically removing the ovaries. So you see, if you have a hysterectomy but you keep your ovaries, you'd still enter into perimenopause and natural menopause, but you just won't have periods, which I often tell my patients that now they've lost one of the parameters that they could use to gauge when they're entering perimenopause, because they're no longer going to have periods. But there are still things you can track. If you still have ovaries, you still, as I always say, go into menopause when it was intended for you to do so, but it can happen a bit earlier. Surgical menopause, you could have your uterus or your womb and still go into surgical menopause if you've lost your ovaries. So an ovarian cyst surgery, or patients who've had cancer and the ovaries were removed, they'll go into surgical menopause or medical menopause. Chemotherapy and so forth can impact ovarian function as well too. Hormone replacement therapy is usually quite important if surgical menopause occurs, and it could be offered to help manage the abrupt onset of symptoms. Feel free to leave any questions or compliments in the comments. Like this video and subscribe to our YouTube channel. You can also book an online consultation with me for a one-on-one discussion of your specific concerns. Bookings for online consults can be made easily via our website. You'll see all the details below, but visit us at azaleahealtht.com.